In this episode of Ask the Doc, I got a great question from someone dealing with bursitis caused by shoulder impingement. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems on the road like pain pills, injections, and surgeries, which only make things worse. So this question came in this week from LinkedIn. I'm going to read it. About 2 years ago, I was diagnosed with shoulder bursitis and shoulder impingement, which really had no cause of an injury. I started with a round of anti-inflammatories that just made my stomach hurt. Then I did 2 injections and 2 months of physical therapy. All the physical therapy did was make it feel worse. My doctor finally ordered an MRI and had me get a consultation with an orthopedic doctor. The doctor said they couldn't see anything glaring in the MRI, but recommended we do exploratory surgery to see what's going on. Not too keen on the idea of just opening myself up to just take a look and just want some real answers instead of we don't know what is wrong with you and let's shoot it up with some more cortisone. Any insights onto what is really going on? Thank you so much for sending that question in, and sorry to hear you've been dealing with this for going on 2 years and really not getting any true answers about what's going on. That is what I call the medical merry-go-round nightmare that you're going through. No one really gets real answers, and they just want to pop full of cortisone and inject it, do some PT that doesn't work, and let's do an exploratory surgery and go in there. Yeah, you're right for questioning that, trying to get multiple opinions to figure out exactly what's going on. Usually what I find is that bursitis and impingement really don't tell us anything about what's going on. We have to get to a tissue-specific problem of what's going on. So what I wanted to include this week was an older video that I made addressing this concept of impingement and what bursitis does and why cortisone shots actually make it worse. So I want to link that one up first. Shoulder is a really complex joint, especially in the human body. It has to move all over the place. So a lot of times what I always say for the shoulder is the shoulder is built for mobility and the hip is built for stability. So there tends to be a lot more shoulder injuries than there does hips, especially in people that are athletes and using their shoulder a lot. But this idea of shoulder impingement, it's like, oh, it's getting stuck in there. That's a very basic, I'm gonna use a fancy word for our intern today, like rudimentary description of what's going on. Basically, it's like, oh, something's getting stuck. I always say whenever you have a problem, you have to have a tissue-specific diagnosis, and shoulder impingement really doesn't tell us jack shit except for it's getting stuck. So why is that shoulder getting stuck? So when we look at the shoulder joint in through here, it is very complex, but very simple as well. So on the front part here, this is the front part where your collarbone is. So we'll give it like a in through here. And basically there's only one muscle that lives on the front here. It's called your subscap. It's very important for stabilizing the front of your shoulder. Then on the back, you actually have 3 muscles. You have one that comes over the top. That's called your supraspinatus. Then you have one that comes back through here and lives all the way back on your shoulder blade called your infraspinatus. And then there's a tiny one that runs right along here called your teres minor. Now, another one that actually isn't a muscle, but it's actually a ligament is called the posterior joint capsule. And it's basically like a ball of ligaments that surrounds the shoulder. And a lot of times what happens in shoulder injuries is that area gets damaged and it causes you to have to put more wear and tear in the muscles around the shoulder in through the rotator cuff. And a lot of times people get these symptoms that feel like impingement, but it's actually coming from a dysfunction. So let's explain that a little more in depth. So essentially what happens over time is you have your muscles and your ligaments, and all they really need to do is stretch and contract. And I talk about this all the time. Over time, what happens is they get overworked. We're sitting in bad postures. We might do too much in our workouts, go to yoga too much, do too much CrossFit, or really just sit on our ass all day long, and that causes a lot of problems. So what happens is the muscles are constantly stretched and contracted, and it happens in ligaments as well. So over time, it's like this glue pours inside there. When that glue gets inside there, it causes 2 problems. It makes your muscles weaker, and it makes them less flexible, which is never good. Everyone knows you don't want to have weak muscles and you don't want to be less flexible. So what happens is this scar tissue builds up in all these rotator cuff muscles. And when it happens, it actually puts more pressure on the joint and the tendon in there as well. So what Anna's probably feeling is actually some damage to what's called the labrum. So in the labrum, where your shoulder comes together, so you got your arm bone here, and then you got your shoulder bone up here, in through there is where it comes together, and there's a cushion in between. That cushion is called the labrum, and all it really wants to do is just slightly cushion that. What happens over time when you don't have as much function in those muscles, they have to work harder, and then they start to jam into each other. And over time, that labrum starts to fray, and you get this thing called like a slap tear. Basically, it's a fancy word to say your labrum fell down to a different area. And that's what's happening a lot of times, where people get like that deep clicking or that popping in their shoulder. It's actually inflaming that labrum, and a lot of times it'll give that feeling of like impingement, but it's not really impingement. And that's what happened with Anna. She went to reach for something and it got sharp really quick. That sharp pain is actually the labrum getting overloaded. Now, as we talked about, you have to have a tissue-specific diagnosis. So what these orthopedic surgeons do, they go, oh, you got pain in there, it's impingement, let's inject it. It doesn't do anything. It actually makes things worse, and it actually speeds up that degeneration in that cartilage. What you really need to do is get an assessment and figure out what's going on with that shoulder and that rotator cuff muscle. And a lot of times there's scar tissue built up in there. So I hope you got something out of that video, maybe learned something and helped get a different insight about why shoulder impingement and bursitis really doesn't tell you anything. A couple take homes here. Number one is get your problem right first. Get the actual diagnosis of what's going on, because how in the hell can you fix a problem if you don't know what it is in the first place? And so many practitioners out there are just diagnosed based off what they're trained in, what the insurance company will pay for, and how they can justify a surgery that's only going to make you worse. Number two, exploratory surgeries are not a good idea, and injections only make things worse. I know the surgeon's like, yeah, we'll just go in there, poke around a little bit, see what we can find, then we'll inject it with some cortisone, see how you do. They don't have to deal with you on the back end when they actually mess things up. Surgeries come with their own risks. You can have problems with anesthesia, you can get an infection, you could even die and not wake up. So before you go in there, you want to know for sure exactly what's going on and have an exact diagnosis. Lastly, get yourself to a peak method trained provider. They are the best at the world at finding and fixing problems that other doctors can't. They get to the root cause of what's going on by figuring out exactly what's wrong and applying the correct treatment. They're going to be the best people to help you resolve this without having to go to an exploratory surgery, get more injections that make things worse, or continue to take those anti-inflammatories, which only make you feel like crap. So if you like the video, give it a like, a comment, share it with somebody that you know it might help. If you're having problems, you're not getting answers, reach out to us, send us in the questions. We're here to help. We want to give real answers and help people get down the right path to getting their problem solved for good, so they can avoid pain pills, injections, and surgeries, which I've clearly made the argument that they don't make anything better. They only make things worse. And lastly, send in any questions you want me to cover. Always happy to help. I appreciate you guys, and I'll see you on the next one. Bye.